Because there are some things we could do that would make a really, really big impact. Like what? Well, for example, we could double the value of the SNAP program, food stamp money, for fruits and vegetables. This has been piloted in a number of cities. There's about 500,000 Americans right now who are participating in this program. And guess what? When people get more value for their fruits and vegetable dollars, they buy more fruits and vegetables. And guess what happens then? They eat more fruits and vegetables. And guess what happens then? Our lowest income communities get healthier. Guess what happens then? The cost of healthcare goes down. Insurance premiums go down. Hospitals spend less money treating emergency care for people who can't afford to pay, which means they have to bill insurance companies less, which means all of our premiums go down, which means the cost of Medicare goes down. Emergency medicine drops. And communities can spend less money on policing, on jails. Because, you know what? When people eat healthier, they live healthier. And they are less likely to become engaged in crime and other problematic activities. Because you know what? Statistically, the healthier your diet is, the more likely you are to be a taxpayer. The more likely you are to succeed in the world. Because it's very hard to succeed when your brain is full of fog and your body is full of pain, when you're not functioning well and thinking clearly. So when we take a simple step like choosing to support healthy food in low-income communities, we are uplifting our entire society. We are uplifting the well-being of our kids and families perhaps the most. So that's one thing we could do. What else? We could have school gardens in every school in the country. Every school all over the place. Data tells us that when kids grow food, they're more likely to eat that food. That when people feel connected to the living soil and the earth, it changes their sense of place in the world. And if we want kids to eat vegetables, the number one thing to do is to get them growing vegetables. We could, of course, offer plant-based options in all of our schools, have meat-free Mondays, support the poor and the vulnerable, and we uplift everybody. What else could we do? Well, we could ban the routine use of antibiotics in our factory farms. Did you know that antibiotics are fairly important? They've saved millions of lives, and they're now threatened. Last year, 30,000 Americans died from antibiotic-resistant bacteria. They got infections that could not be cured by any known antibiotic. Infections that would not have existed in that way just a couple decades prior. 800,000 people died last year worldwide from antibiotic-resistant bacteria. Many health researchers are afraid that we will enter soon into a post-antibiotic world. That within the next generation, the most powerful medicines ever developed for the curing of disease could become impotent. Why? Well, partly, of course, antibiotics may be overprescribed. Partly they get prescribed more when people are sick more, and we've got a lot of sick people. But also because most of our antibiotics are not being given to humans. They're being given to livestock. Right now, 80% of the antibiotics used in this country are given to livestock, not people. More than 2/3 of all the antibiotics used worldwide are given to livestock. And they're not just given judiciously to sick animals to help them get better. They are given consistently and routinely in every dose of feed because they help the animals gain weight faster, to fatten them up more quickly. And also because they're in such deplorable conditions that some of them might not survive without antibiotics with every dose of feed. So if we ban the routine use of antibiotics, and if we say, hey, only for an animal that's actually sick, and by the way, you can't treat animals in ways that they all get sick, then what does that do? It might preserve these medicines. You know, you could say that our factory farms have become biological weapons factories. They are literally breeding and producing biological toxins, these antibiotic-resistant bacteria that are killing us by the tens of thousands, that threaten to kill us by the hundreds of thousands and by the millions in generations to come. But we can help take a bite out of that when we say no to that system. when we do not support it with our dollars, when we do not consume it with our mouths, and when we help create policies that shift the course of all of this. It makes a big difference.